Hello, 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 hello. Let's talk about obstructive sleep apnea in women. Headaches in the morning, fatigue, anxiety, depression are really some symptoms that you may not realize could be from untreated obstructive sleep apnea. So let's dive right in. Today's topic, ladies, is what women need to know about obstructive sleep apnea. If you don't know who I am, I'm Dr. Val, an integrated sleep medicine physician and your women's sleep health expert, here to break down all the different things that can impact someone's life if you're a woman, transgender men going through a period of transitioning, because that can relate to you as well, especially with sleep apnea. And we'll talk about why in a little bit. So, always start with definitions. Number one, what is obstructive sleep apnea? Obstructive sleep apnea is a medical sleep condition where the muscles of the upper airway, typically it's the tongue, can relax and narrow and close off your airway. So, snoring is very common. Snoring is not normal. I'm sure I have videos on that. Where snoring is partial collapse of the airway, you make a noise. Believe it or not, you don't have to snore to have obstructive sleep apnea. And this is something that we see in women. Go figure. Alrighty, so women present a little bit differently than men when they have obstructive sleep apnea. The way we know for sure, if you have it, right, aside from a bed partner witnessing you, is really to do a sleep apnea test. You can do this in the comfort of your own home, which is really, really nice. There's so many different types of kits available. However, one caveat: if you do a home sleep apnea test and it's not looking at your brain waves, it's best to go to the lab for the confirmatory test, because when we look at your brain waves, it's called EEG and electroencephalography. Then we know for sure if you're awake or asleep. Women, and I always like to say because women are smarter, but really we have more sensitive brains in the fact that our airways may partially collapse and wake us up before it completely collapses. The technical term for this are RERAs, respiratory effort related arousals, and that counts within the obstructive sleep apnea number, which is your AHI, apnea hypopnea index. And what we're looking for is how many times you have an apnea, right? That's 90% decrease in flow, or a hypopnea, 30% decrease in flow with a decrease in oxygen level. And if this happens 5 times an hour or greater, guess what? Ding, ding, ding. You have the diagnosis of obstructive sleep apnea. So let's go into the breakdown of why it looks differently for women than men. Well, women can have less severe obstructive sleep apnea overall, meaning a lower AHI index. The biggest, I think, sort of disservice that we've done through women in all of the medical field and a lot of things in general is that women weren't included in some of the original research. So, still, snoring, obstructive sleep apnea is viewed as a male condition, but it's just because we didn't study women enough. Getting to study women more and more, which is helpful, but it also comes to the point where, women, we just don't know about this condition. Doctors don't really screen for it. So hopefully this video will help raise some awareness. If you are having some of these symptoms, go talk to your healthcare professional provider about getting that sleep test. I said in a podcast once that I think everyone should get a sleep apnea test, and the host was like, "What, are you crazy?" And I was like, "Yeah, it's so common. 1 in 5 adults have obstructive sleep apnea. Higher numbers as we get older, as we go through perimenopause and menopause. So if you're above 50 and you're tired, I would say go get a sleep test. Even if maybe you're above 45, 47, right, is the technical age where women go through perimenopause. So women are diagnosed less than men because the presentation is different. So I read this really great article and I linked it in the references below, but obstructive sleep apnea, women specific issues and interventions, a little bit older. It was from 2016, but really, really good. Broke down a lot of different things. And they said that women have less typical symptoms. So what are the typical symptoms of obstructive sleep apnea? Snoring, gasping or choking, or feeling sleepy during the daytime. 40% of women didn't have these symptoms, which is so true. Even in my own general practice, sometimes women come in and they just have a hard time staying asleep. They're fatigued. They have morning headaches. Insomnia is a really common concern. Restless legs, depression, nightmares. I hadn't heard of that one, but nightmares could make sense, right? If you have fragmented sleep from obstructive sleep apnea, maybe you're remembering your dreams more. Palpitations, hallucinations, and then headache. I think I already said those are some of the symptoms that women present with when they have obstructive sleep apnea. What else? 90% of obstructive sleep apnea women is said to still be undiagnosed, right? 90%. That number is huge. For But actually, when you take a look in the context of obstructive sleep apnea, still a lot of it is undiagnosed. Some of the older data says about 80%. Hopefully, we've gotten down by then. But yeah, still a lot of us are out there are tired unnecessarily. And going back, some of the reasons for this is for women, it's really embarrassing to admit that they snore. I've had patients come into me and they said, my daughter doesn't want to go on the trip with me. We planned this really amazing trip, but because of my snoring, she wants me to get that figured out before, or, I have to cancel. It's uncomfortable to sleep in a room with someone who's snoring because it really disrupts their sleep. So one of the best things I like about sleep medicine, I say it's a twofer. If you can treat someone's sleep, the bed partner actually can get better if the snoring improves as well. Oftentimes, women actually don't necessarily seek help. I was talking to someone about this, so a lady, and she said, I didn't even realize sleep medicine was a thing. There was its own specialty. Yes, typically it's a 1 or 2 year fellowship after internal medicine, pulmonary neurology, psychiatry, even ENT. The throat surgeons can go into it. But yeah, it's its own subspecialty. And sleep is so important. It's so vital. If you've heard me talk about it before, it's foundational for your overall health. You can't exercise well. You can't have good nutrition. Your brain health, your emotional health is so affected if you don't get good sleep. So biased, but yeah, sometimes we just don't realize it's an issue because if you talk to your friends who maybe have sleep apnea as well, everyone's tired, right? A lot of us are busy moms, we're working, we're taking care of our family, we're working on our side hustles, and it just doesn't leave much time to sleep. And sometimes we think that plays a role, but it certainly can. But on top of that, if the quality of your sleep is disrupted because basically your tongue is falling back and choking you at night, not a good story. Yeah. So yes, if you have some of these symptoms, go get tested. Even if you do have mild sleep apnea, some physicians won't even give a person a machine. I've seen this before if the symptoms are mild. However, I do encourage everyone to get treated. I do recommend therapy for all of my patients. The CPAP machine, I think, still is the best treatment option, but it's not for everyone to have a mask on your face. So CPAP is continuous positive airway pressure. And the way it works is, I'm sure you folks have seen those waving arm balloons, usually by the side of the road, by car dealerships. If you imagine your throat like a balloon collapsing, what we do is force air in to help you breathe. And it works really well. Some of my patients stop breathing over 100 times an hour. With this machine, we can get it down to less than 5, which is pretty phenomenal. Mild sleep apnea means you have difficulty breathing between 5 and 14 times an hour. And with that said, some of the insurance requirements say you have to have either high blood pressure, maybe some mood disturbances, excessive daytime sleepiness, even to get on the machine. I can tell you, if you are having mild sleep apnea and you do improve by being in therapy, it can be very life-changing and transformative. I've had some patients who've had a power outage at their place. They actually went and got a hotel room just because they needed to sleep with their machine and their sleep apnea is mild. So if you're looking to improve the quality of your life, definitely get on therapy. If you have more moderate to severe, please, please, please get on therapy. The reason for that is to prevent cardiovascular disease. Cardiovascular disease, heart attack, stroke, irregular heartbeat, heart failure. Heart disease is the #1 killer in the US. And guess what? If you're not getting an adequate amount of sleep from sleep time, typically you want at least 6 hours, more than 7 is ideal. But if you have untreated sleep apnea, it's moderate to severe. You're just increasing your risk of more heart issues, right? If your heart's not getting enough oxygen when you're asleep, oh man, gotta get on treatment. Machine health, not the only treatment option. There's other options such as mouth guards that dentists can make, oral appliances, or a specific name that moves the jaw forward. Weight loss can help, changing your body position, sleeping on your side instead of a back, getting an adjustable bed where your torso is raised can help. If you have big tonsils, you can have those removed. There's certain dental therapies, maybe where you can expand your jaw, or oral surgery, help open up your airway even more. Tongue exercises, if you play a double reed instrument, if you sing, right, you want to make sure that your tongue is resting on the roof of your mouth and it's not falling down as much. Certainly that can help as well. But yeah, I would say if you do have signs and symptoms of sleep apnea, which I'll go over again, typically they are snoring, gasping, choking, feeling tired during the daytime. But for women, guess what? You can have insomnia, you can feel anxious, you can feel depressed, you can have a hard time staying asleep, nightmares, headaches in the morning is something so common, palpitations, and guess what? Rates double to triple as we go through perimenopause and menopause. So if you're hearing my voice now and you're tired and you can't figure out why, your doctors run all the blood tests, your thyroid, you're not anemic, your vitamin levels are normal. And even if you're getting an adequate amount of sleep, I would say this is the biggest one. If you're getting at least 7 hours and you're still tired, get that sleep apnea test. If it's a home one and it's negative, take that next step further, get that in-lab sleep study, really just to rule it out. So common, so helpful. I myself have obstructive sleep apnea, and when I use my machine, I don't always use it. I have two young kids, and sometimes I'm hanging out in my son's room. And I don't bring my machine there, but I do feel so much better, especially that afternoon slump, that 2, 3 o'clock where I'm just feeling a little bit drained. I feel like my battery's lasting a little bit longer. So that's my own story with sleep apnea. I hope you found this video helpful. I'm Dr. Val, an integrative sleep medicine physician, women's sleep expert. Hope you subscribe and share this video with people who need it. And one plug is I do now have a free membership. It's on the platform School, or I do live Q&A. I'll have our own special member workshops, some discounts in there. Hope to see you on the inside and also in our next video. Thanks so much for watching. Sleep well.